Hi, I'm Manny, a psychiatric nurse practitioner. I got my doctorate from the University of Utah. I have many different specialties. Excited to actually be part of this team for the collaboration and to kind of bring in a mix of what I've done in the past to bring toward this company, because it seems like it's very up and coming and very well managed group that I'm hoping I can actually, be part of something. So I've been a psych prescriber for at least a good 4+ years. I've worked many different places so far. So really it kind of came to a head where I was given an opportunity to come here. And so I figured it'd be a good time to get on board with kind of an up and coming company that seems to be very aggressive and looks like they're doing really well. So originally my background mainly kind of started off in PTSD. Most of my training I received coming out the gate was through the VA up in Salt Lake, and so I worked with many a different veteran from any conflict, and so it was interesting seeing the generational piece of different wars and how it's affected the different veterans, both men and women. And so then that led me to the next aspect of my career, which was addiction, to where you kind of see the piece of trauma sliding into addiction. And then that also worked with kids, teens. I worked with the parents program. I've worked with the adult program. A lot of different aspects of the addiction world. I still do keep a foot in the door with the addiction piece. So I still work with teens, school-based kids, and these are kids that are unfunded, that are on Medicaid. So that piece I still have a good passion for, because I know it's an underserved population that they do need the help. And so I feel I can still keep that skill going if needed. And so it sounds like I like to play music a lot. I'm in a band, and so it's an Irish rock band, and so I've been playing with them for about 10 years. We play a lot of different festivals. As a plug for the band, it's Swagger, so if you go to swaggertheband.com, that's our band. I'm playing different places. We play a lot of festivals in Idaho. We're playing in Washington State in the fall. We're playing the Boise Highland Games. We might be going to Montana, I'm not sure. We do play Idaho a lot. Throughout here, we're going to Helper, Utah this weekend. We're playing the Walsburg Festival, and we're opening for Ryan Shoup and the Rubber Band, those type of things, just a fun thing. And then another thing is I train jiu-jitsu. I've been doing that for a good 20 years. It's been more of my, escape to kind of keep me in a good place, physically, mentally, emotionally. It's kind of a nice release, and so it keeps me grounded. And so that kind of is the one thing I try and do as much as possible, try and stay active. And then I play play upright classical bass, and it's called the West Valley Symphony. And we play, let's say, the Gail Miller Sing-Along Christmas at the Vivint Center. If anybody's ever been to that. Also playing a quartet with a group of people just for fun. Just those are kind of the odds and ends that I do with my life. So
that's awesome.
So one of our fellow colleagues, Aubrey, her and I used to work in oncology together, and so for years you saw the medical piece, you saw that part of what treating cancer, but then you didn't realize what the aftermath of cancer does and chronic illness. And so that's honestly one thing that is a piece that people tend to leave out. You make it through cancer, but then you are heavily traumatized by the fact of that the cancer can come back, you can relapse, you have that threat of death on you almost on a daily basis. And it didn't matter to the age. I sat there and watched every, age from an infant all the way up into a teen, and everybody was affected. Nobody was left. There was no bias. Everyone in the family, friends, family, caregivers. But what was interesting, there was nothing being done about it. Nothing was being addressed. Mind you, we did have social work, they come in, but you couldn't really do some in-depth stuff on the floors just because that's the nature of the work. It just wasn't the right place. And so after a while you realized you think you could do more. And so it led me down that path of working in the mental health field, which led me to obviously going back and get my doctorate. And so now, which then led me to these different aspects of working in addiction and working in trauma, and now working in, autism. Another place I have worked in through is with personality disorders, and so just a whole myriad of different things. But it kind of stemmed from that, watching years of people go through suffering, their cancer's gone away, but we didn't realize all the other scars we left. Just because you're not seeing them doesn't mean they're there. So a little bit of everything. You know, like I said, I've worked with autism before. You know, there's that piece of saying, you know, to where you need to go into a higher level of care, but I am comfortable with outpatient autism. I've worked with it in residential before, so I've seen the really more kind of extreme side of it. I've worked with, you know, your bipolar 1 clients, bipolar 2, schizoaffective, schizophrenic, some of the people that are straight out of jail, you know, that type of clientele, people with severe addiction, you know, clients who are working with a personality disorder, which can be the most difficult because a lot of them don't realize they have it. You know, obviously your depressive piece, anxiety, trauma, of course, delayed dissociative complex trauma, things like that. Really a kind of myriad of different things. So it's interesting, kind of seeing a little bit of everything, comfortable with a lot of aspects, but at the same time, comfortable enough to know when, if it needs a little bit more than what I can offer, I have no problems saying, hey, let's send you to somewhere that can actually be more acute to what you need. But at the same time, if I can handle it, I totally will. Well, it's interesting because it's a new model that you see. Instead of somebody finding me, I need meds, somebody's coming in just for that. You're no longer just a med mill. You're not technically sending somebody out with meds. They don't do much about it. They go back to their lives with no real therapeutic dynamic going on. There's no real possible healing to where these meds technically should just be short term, unless there's some serious mental illness that require that, where you can actually bring it into kind of a better, a bigger sphere of it all, to have the person going to seek counseling, get through the depression, find out I no longer need this antidepressant. It was just enough to keep me afloat, or my anxiety is now managed with my skills versus I need to be on these meds the rest of my life. So having that type of piece is very attractive as a provider and as a prescriber, because you're less likely to hit those walls, hit those barriers where the meds aren't working, and then we just have to keep adding, or we have to keep increasing the dose. So having something like this is more attractive for me, because that way success can actually be made long term versus I just need my med fix and I'm done. And I always tell them this: therapy should always override meds. You know, I should just be a supporting person. I shouldn't be the person that you're relying on. The person they should rely on themselves, but the therapist does more of the heavy lifting than I do.